Advantages of liter flow CPAP. It uses less oxygen, so your bottle lasts longer. It comes with an easier to apply head strap that does not get twisted. It is simple to switch tanks, and it comes with a gauge to monitor airway pressure. No special adapters are required to administer a nebulizer treatment or connect a viral filter. It comes with a conformable forehead pad with a simple-to-use adjustment mechanism. It is easier to fine-tune mask tightness, too. The disadvantages of liter flow CPAP is you need a second O2 source for supplementary oxygen and additional delivery devices, like a cannula or neb. Continuous positive airway pressure delivers gas, oxygen, and room air at a constant flow rate and pressure. The continuous flow and pressure keep the alveoli expanded after exhalation, but it is not delivering a breath. Therefore, the patient must be spontaneously breathing for it to work. It helps by increasing alveolar recruitment with positive end expiratory pressure delivery. The alveoli expand in size, but do not collapse between expiration and inspiration. By increasing the alveolar surface area and preventing collapse, gas exchange is greatly improved, even in the presence of pulmonary edema. CPAP delivers about 30% oxygen. That's because, in most pre-hospital CPAP units, the oxygen mixes with room air and the circuit or mask without an oxygen reservoir. CPAP is usually a helpful intervention and should be applied as early as possible in the clinical management of patients with moderate to severe respiratory distress with wheezing or rales from pulmonary edema, CHF, COPD, and asthma. When is CPAP contraindicated or just a terrible idea? CPAP is contraindicated in apneic patients, pneumothorax, medical or traumatic, bariatric patients, actively vomiting patients, altered mentation, closed head injury, hypotension, facial fractures, and any anatomical anomalies preventing an adequate mask seal. You can apply a nasal cannula under any CPAP mask to boost supplemental oxygen delivery. Setting the nasal cannula to 6 liters per minute increases the concentration to 44%. A paramedic may ask you to apply a nasal cannula while CPAP is in use to increase the percentage of oxygen being delivered. If you are thinking about utilizing a nasal cannula, apply the cannula first, even if you presently lack a secondary O2 source. This way, you don't have to remove the mask later to apply it. No one wants all of that alveolar recruitment to go to waste. Once additional oxygen becomes necessary, attach the supply line to a flow meter. Begin with a PEEP of 5 for all patients because 5 is easier to tolerate initially. Get the patient to wear it and become comfortable. Then set the goal PEEP as the patient's tension eases. Let the patient gather themselves after application of the CPAP. It is okay to wait for the patient to start breathing easier. Make sure they are sitting up nice and high, pad behind their back if necessary. Coach the patient and give an abundance of positive reinforcement. Let the patient hold the mask to their face to start. It gives them control and assists with the process of securing the mask. Here are a few things you could say to encourage the patient before and during the application of the CPAP mask. The CPAP mask is going to make you feel better. I've got you. It is a lot of air and oxygen. Hold the mask, you have control. Give it a couple of minutes to get used to wearing it. I'll be here with you the whole time. Focus on your breathing. I'll try to ask you questions that you can answer by nodding. You look better. You're not breathing as hard. Do you feel better? Can I do anything to make you more comfortable? How does the mask fit? Is it too tight? Things you should not say before and during the application of the CPAP mask. This is a great mask we have here. It's going to make you feel claustrophobic. This is an exceptional mask that we have here. It will feel like you have your head out of a car window at 60 miles per hour. You know, like a dog. This is a unique mask that we have here, but it will be tight and uncomfortable, but you must wear it.